Anon Ketab showed in his presentation, we have quite a remarkable overall response rate and of more than 60%. And what we also see is that the responses are usually coming very fast after the first 2 cycles of treatment in those patients. So the median PFS is a couple of months, but in particular remarkable is the duration of remission, where some patients appear to be in remission for some longer time. And therefore, I think what the data tell us as well is that we have to look for maybe combination treatment, how we can get more patients in remission who will not progress from the beginning, because as he also showed, some of the patients who in the end came off the study because of progression, they had at least some response. Many of them had a progressive disease because they, for example, they had on a different site a new lymph node. So I think what the data shows is that we have to evaluate that in combination treatment. In addition to that, what we also see, that there's a little bit more cytokine release syndrome and also a little bit more ICANS, and we know that from DLB, de novo DLBCL, for example. But I think also with the growing number of patients being included, we learn how to deal with administration of dexamethasone, for example.